came to know about speed. Then I took the subscription there, and then my actual prep for MCA started. Made my notes myself and then revised them there. That's how I use speed. Yes. And I want to thank speed as because your teaching and your guidance was very precise and it was very inspiring as well.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute and to you, to Dr. Ramesh Bhargav, for scoring rank number 23 in MCH Surgical Group NEET SS 2025 session. Congratulations to you.
Thank you so much, sir. Thank you so much.
Wonderful and great to have you in the session. And also thank you for sparing your valuable time to share your experiences with us and also to our students.
Sure, sir. My pleasure.
Great. So can we know your brief background, where you started, to the date, whatever?
Sir, my name is Dr. Ramesh Bhargav. I've completed my undergraduation from Andhra Medical College, Visakhapatnam, and I've completed my MS General Surgery from SCB Medical College, Cuttack, Odisha, in the month of October, sir.
Yeah. Great. Wonderful, beautiful accomplishments so far. What is the super specialty you're interested in?
Sir, I'm interested in surgical gastro, sir. Yeah.
Who inspired you? How you got this interest?
Sir, every aspect of surgical gastro, sir, right from the diagnosing a patient, the pre-operative thinking which you have to put in, the post-operative complications, and the surgical skill as well required to do those surgeries. Every aspect of it, I was just fascinated by it, sir. And I felt this is what I want to do for the rest of my life, day in and day out.
Very good. Very nice. Excellent. Good, great field. And you are into an appropriate field that you liked. And we want to know, once you decided to do a super specialty, what all you did, how you worked towards in the back end to achieve this good rank in the front end.
Sir, to start with, sir, I felt it required a good baseline knowledge, sir, before you start into the proper MCH preparation for MCQ'S, sir. So over a period of 3 years during my residency, whatever cases which I have seen day in, day out during my right from trauma to the electives and emergencies, I just went back whenever I had little time. I went to the books. I read them very specifically because my consultants and my teachers told me you cannot read all the standard books right from cover to cover. You have to be specific in whatever you want to learn. So at the back end, I started reading all those during the period of my residency, sir. And then coming to MCH preparation as such, I started in the month of mid-May around, sir, when I was preparing for university exams. So this was the time where I had the opportunity to read the cover to cover the Bailey and Sabiston, and for GI I read some of Shackelford and all, sir. So then I came to know about speed. Then I took the subscription there, and then my actual prep for MCA started in the month of May mid around, sir.
So what did you do with the speed? What speed did you?
Yeah. so in the month of May, I started with first my main goal was to read the textbooks, and because I didn't have the luxury of time to sit and prepare for, because I was giving more importance to my university exams, I just saw a few videos where I had conceptual doubts, sir, to start with. So I started with urology. Then once I got hung off sitting in front of the video and seeing, it took me some time. So I slowly built on that. Then I was very specific in which part I wanted to read, sir. Because after the university exams, I hardly had 2 to 3 months of time to prepare for MCH proper, and I actually wanted to give INA-SS properly. I got CML 16 and AML 22. So I saw Basan sir's videos at that time. And at the back of it, I started general surgery as well. I started with urology by Farooq sir, then CTVS by Arun sir, and then endocrine breast and general your videos, sir. I couldn't attend the live classes, most of them, I'm being honest, because I didn't have the leisure or the luxury of time. So once the videos were recorded, I saw them at 1.5x, made my notes myself, and then revised them, sir. That's how I use speed. Yes.
Great. Now, can we know number of questions you answered? According to you, how was the paper? Can you share?
Sir, I answered 145, sir. I felt the paper was on moderate to moderate level, sir. And most of the things, they were more on clinical and practical aspects. I felt they were touching upon, especially the CTVS part and the emergencies, sir. Like, I think they have touched all emergencies of all super specialties, I felt, sir. So the people who are definitely attending their wards and the specialty postings, definitely I felt they had a better edge in coming to a better answer.
Very good. Excellent. Now, what will be your advice for the future aspirants?
Sir, first and foremost, there are so many people who have done better and they can give a way better advice. But my advice is to have a good baseline knowledge, sir. That is very important for a surgical branch. Then think about super specialty. First, you have to use your 3 years of time very judiciously and see what you want and what your long term goals are. Then start the specific preparations. That's what I would advise them.
Okay, great. Time to thank, and whom all do you wish that you want to thank them from day one till date they have stood by you?
Sure, sir. To be honest, I'm very fortunate to have so many people around me who have encouraged me to go through my passion, sir. It's not a thank you, but I would say this is a gratitude or a reciprocation from my side with the support that they have given me, right from my parents, my sister and my brother-in-law, then all my teachers, sir, right from my undergraduation. I'm still in touch with all of my teachers right from my UG time, and in SCB, all my teachers, they have always helped me right from the day one. Then my seniors and my friends. There were times where I felt I was low after, especially after INI result. I was a bit disappointed. I had 1 week of time to get back to the NEET. So at that time, all these people helped me out. They told you don't give up. You just go. You can do well. And I want to thank Speed as well, sir, because your teaching and your guidance was very precise and it was very inspiring as well, sir. Uh, so it's a gratitude, not a thanks to all my ecosystem who have helped me out to reach what I have done, sir.
Great, doctor. Wonderful. And
Thank
you
you
are
so much.
everybody, and everything. People are seeing this video will be very happy to listen to all your words, good words. The students will be very clear to do what they want to do and supposed to do.
Sir,
And
thanks.
again, we wish you all the very best and all the success for a great career in surgical gastroenterology that you want to do. Best wishes to you.
Thank you so much, sir. Thank you so much.